Show.
All right, y'all. It's Wellness Wednesday. Every Wednesday on the Rickey Smiley Morning Show, we got the one and only Dr. MJ Collier, and he is back to help you stay healthy. In October is Breast Cancer Awareness Month, Dr. Collier. Happy to have you this morning.
Thank you so much, Rickey Smiley. Good morning, Rickey. Rocky,
Yes, sir.
Special K, Gary with the T, Alfredus, and the Brat. And thank you once again for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show.
Absolutely, Dr. Collier. And make sure you add in there, and I know you got a lot of stuff for us to talk about the recent updates in research and treatments for breast cancer.
Oh, absolutely. So this entire month is Breast Cancer Awareness Month, and it's a timely topic, and it takes a month. So it's going to take us, we're going to do more than one segment on breast cancer, Rickey, because there's so much good information out there. So the number one cancer in men and women is lung cancer, even if you never smoke. Breast cancer is the second most common cancer in women. The bad news, Rickey, is that the rates of breast cancer are going up. This may be due to better detection methods, but there is clear documentation that younger women are now being diagnosed. Every cancer category is going down. Younger people are being diagnosed. We're not sure what's going on with the environment. There's a thing called epigenetics, you know, how you're living, what you're eating, etc. But rates of all cancers are going up. But it also may be due to we got better detection methods. So I know this affects virtually every female patient that I have now. And because of some of these new detection methods, it's frightening to women because they'll go in they're used to getting traditional mammograms. And all of a sudden now they're getting these high-tech 3D MRIs of the breast, and they're getting ultrasounds of the breast almost routinely. So it really frightens them because they say, well, I had my mammogram and they found something, and now I need to get other tests. And it's not necessarily that they found anything. It's that you just need additional testing to optimize your screening. So, but patients will call me. I had a mammogram, and I'm concerned about it. And I saw this with my mother-in-law, with my wife, and with my daughters even. When they go to get mammograms, the new technology is a little concerning. So don't be afraid, don't be frightened if you are going to get your mammogram. But two, make sure you go get your mammogram if you're age 40 or older. It is covered on Affordable Care Act. It should cost you absolutely nothing, not even a copay, and you should be eligible if you meet that criteria. Basically, you're a 40-year-old female and you breathing, you qualify. So it should not be an issue. I've had recent conversations with people, and they're saying they're getting pushbacks from their insurance companies, and you shouldn't. Basically, you have to be your own advocate. Sometimes you have to call that 1-800 number and basically respectfully request, don't fuss and cuss, but, don't make it hard for people to work with you, but then get that test. But even if
that last part again.
Yeah, get that test. But again, don't make it hard for people to work with you or for you. The person on the phone, doesn't have a dog in the fight. They're just following a script that always ends in no. So even if you have to pay for it, the test is not that expensive, and it's just important that you get it and not wait on the insurance company to do that. So how common is it, Rickey? 1 out of 3 females are affected each year. So it's affecting over 300,000 new cases of invasive breast cancer will be diagnosed this year in women, with about 60,000 cases of what's called ductal carcinoma in situ. That's an easy to treat. It's localized within the milk ducts of the breast, and you can basically just do what's called a wedge resection, remove that. And I tell patients, don't just get a biopsy. Have them remove everything. If they find cancer, fine. If they don't, if they find cancer, it's already been removed now. If they don't find cancer, it's not going to deform your breast tissue. But it saves you from having to, one, go through that stress and anxiety of waiting, and two, you've taken care of the problem. So it's very important that you do that. So 1% of people have increased each year. The rate is going up, like I said, and it's the second leading cause of death in women. So symptoms and causes, Rickey: new lumps or mass in your breast pain or nipple pain, or dimple breast skin. It makes it look like an orange peel. They call it pody orange. A nipple turning inside. Your outer nipple becomes an innie, like your belly button. Nipple or breast skin that's dry, flaking, thickened, or red, or swelling in any part of your breast. Swollen lymph nodes under your arm or near your collarbone. Any of those signs or symptoms, don't hesitate. Don't say, I'm just going to watch it. At least have it evaluated by your primary care doctor.
All right, you're on with Dr. Collier. Good morning.
I was curious, for breast cancer, I know that we're getting that now earlier and earlier as women, but the doctors will only start testing you. They have you fill out this form now at the GYN, and if it's not an immediate family member, father, mother, somewhere in that close vicinity, they will not test, although it runs in the cousins, the aunts, the uncles. Why is that?
Again, it's just the guidelines from the insurance companies. They're literally trying to save that money, and they should not. If you have a family history, you have to be your own advocate. It's not just up to the doctor. You call the insurance company, that 1-800 number on the back of the card, tell them you have a family history, you want to get your mammogram covered, and if, the first person you talk to on the phone is not a decision maker, their job is to say no. They have a script, and it always ends in no. So you need to talk to the next level, a manager, or ask for the medical director. Once you've done that, you have changed it from to your own advocacy, and now they want to work with you. But just saying, I need to speak to your medical director about getting a mammogram, and also your doctor should advocate for you with that history, not just write it off and say, oh, well, they're not going to cover it. It requires some extra time, energy, and effort, but that's what you should get from your doctor. If you don't, you need to change doctors.
So I just want to know, Dr. Collier, there's all this research or this talk about birth control and menopause medication. Is there a risk for breast cancer with use of birth control or use of menopause medication?
There is an increased risk for people that have their first child at latter stages of life after age 30. There's an increased risk for those that have late menopause versus early menopause. So no real relationship with types of birth control, because there are various types, but they are trying to see if some of the implantable ones that are progesterone-based might increase cancer risk, but the risks are going up and the rates are going up. They're looking for some reason to relate it to, and they have not found a cause and effect for that yet.
Okay.
All right, let's go to the phones. Good morning.
My question is, if you are in stage 3A CKD, after years of high blood pressure and diabetes, now that they are managed and very well controlled, can your kidneys repair themselves?
Absolutely. Your kidneys and your liver are two of the body organs that actually have a regenerative capability. They can repair themselves. The primary thing to do first is to control those two disease states. So get your blood pressure control, get your diabetes control, and the simple solution that most people avoid, you need to drink more water, at least 8 glasses of water per day, not counting anything else that you drink. The measurement that we're talking about is the glomerular filtration rate, or GFR. That's the rate in which your kidneys are filtering your blood. And so when there's more fluid or blood to filter, the rate of filtration goes up. A normal glomerular filtration rate should be 60 or higher. Stage 3 sounds like a lot, but that's actually down to in the 50s. So that's not bad, and it should be recoverable if you do those things: control the diabetes, control the blood pressure, and drink more water every day. There are also medications, including the GLP-1s, that's the Ozempic and the Mounjaros, that help improve kidney function as well.
Aren't you? Dr. Collier, good morning.
Hi, good morning. I'm curious. I am a breast cancer survivor, and they put me on this medicine called anastrozole that I have to take probably for the next 5 to 7 years. And I would just like to get his thoughts about that medicine. It's listed as having a lot of side effects. I haven't had any issues with it yet, but I'm just curious the impact long term.
The key point about any medication when you look at the side effects is this: if it affects you. Those are potential side effects that can happen, but rarely do. But sometimes they are tolerable even when you do have side effects to a medication. So anastrozole is a hormonal-based therapy. That means you have hormone receptors that are responsive to that treatment that limits the growth or prevents the growth of cancer cells. So it's a relatively benign therapy, and 5 years is the survival rate. So you go through it for 5 years, you remain cancer-free, and then you're declared cancer-free. And so that 5 years will come and go, and you'll have less concern about, do I have cancer, and constantly worried about every time you get an itch or a twitch, is that the cancer flaring up. So that is a good therapy. There are other drugs like tamoxifen that will also do those things. So it sounds like your doctor's on top of it and doing exactly what they need to do.
All right, Dr. Collier, let everybody know how you can be reached, and you know we always appreciate you.
Oh, Ricky, thank you so very much. You know I can be reached on all social media at ASKDRMJ. And tonight, 6:30 p.m. Eastern Standard Time, YouTube Live, Facebook Live, and Instagram Live. Ask Dr. MJ. Why? Because your health is important. The only interactive healthcare forum that allows you, the listeners, to ask your healthcare questions. Subscribe to my Ask Dr. MJ YouTube channel. There are hundreds of videos on various healthcare topics, including breast cancer. Go to my official website, lipodrops.com, where you'll find information on Dr. Collier's Doctor's D, a unique formulation of vitamin D3 at 5,000 international units a day, always the initial supplement for breast cancer or any cancer. So don't wait for a cancer diagnosis. Try to prevent your risk and lower your risk of cancers by taking vitamin D3 every day. Every day. And remember, follow me at Ask Dr. MJ on all social media platforms. Get your 2025-26 flu shot available now at your local pharmacy. You don't need a prescription to get it. Optimize your health during the wintertime. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew.